Hey everybody, my name is Mark, for those of you who are used to seeing my wife Sarah on the channel. But my name is Mark and I'm 45 years old. I have had some effects of dystonia for at least the last 20 years. And September is Dystonia Awareness Month. And one of the things that, as I was talking to someone else this morning who suffers with dystonia, and we were discussing the way people see dystonia patients, people who deal with this condition. One of the things that I was thinking about was we make these videos. Many times we have this whole Dystonia Life section of videos, which generally is showing different symptoms that I deal with, whether it's facial tics or gagging or inability to walk or convulsions and things like that. Every dystonia sufferer has different symptoms. People have different struggles, people have different strengths and abilities, and we don't want to act like people with dystonia are a single group. But we do want to show you, to some extent, how this condition affects not only the life of the person with dystonia, but also our families, also our children, our wives, and even our churches and things like that. As I was talking to this person this morning, he was saying that he still works, and praise God that he's still able to work. But he was saying that when he has a severe spell, a dystonic spell, if he loses the ability to talk, then there is a regulation at his workplace that says there must be an ambulance called for a safety check to make sure that he is indeed okay. And that's one of the things that has happened to me a lot. When I was working as a nurse's aide, I was working in a nursing home, and I was doing one-on-one care with people, and I was doing that until a little over 3 years ago, when my spells and my storms became so severe that I wasn't able to continue working safely, that I was having more spells, I was losing more control of my body and my ability to do things. But I was also losing cognition, losing some of my ability to remember, to be able to put my patients somewhere where they were safe, or to be able to remember the instructions that I needed to give to a nurse or to make reports. So as I struggled more with that, I was unable to work anymore. But there was a couple of times there as a CNA working at a nursing home where other CNAs would take me to the nurse and ask them to check my blood pressure, to check my blood sugar, to check my pupil dilation, because I'm walking up and down the hallway and struggling to keep it together. Sometimes shaking, sometimes just having problems with speech or gagging, which can look like I'm going to throw up, even though I don't. You can see some of our other videos for that, to see some of the symptoms we deal with. But I was thinking about this idea of working and being around people that don't know us, or know us but aren't able to help. Certainly there's nothing that can be done for many people with dystonia. There are some medications that do help, and I'm not going to get into what those are because some of them are controversial, and I'm just not having that discussion today. But I wanted to talk about the issue of calling the ambulance. So what happened to me multiple times at work is I would have a bad enough spell that the nurse would say, well, your blood pressure's through the roof and you're having trouble speaking and you're reporting tingling in your limbs and you're having some other problems. So we're going to have to call an ambulance. And as they're getting to that point, I actually was able to reach into my pocket, grab my phone and dial my wife, and was able to get the phone to them, maybe whether I was shaking or whatever at the time. Even if I couldn't speak, I was able to get that phone to my director of nursing, who was sitting there in front of me breaking out because they had not seen something like this before. And so I was able to give them the phone, and they talked to my wife, and she said, oh yeah, he must not be feeling well, maybe he needs a break or needs to sit down, take a rest, because we've been dealing with this for 20 years. And to the uninitiated, it looks like you're having a stroke with some of my symptoms specifically. Some of the symptoms that I've had are blood pressure through the roof, pain in my chest and my arm. It kind of looks like a heart attack. Sometimes my face gets really droopy, more on my left side than my right. Those kind of things, they're signs of stroke. They're signs of very serious health conditions. So there is a right that's a right response if you're ignorant of the situation. But as things continued on, as I was able to work more and then eventually not be able to work anymore, even going to church at times, when we would travel or visit another church, it's not uncommon for me to have a spell. I have spells multiple times every day. And larger crowds and noisier places and unfamiliar places, there's just more stress, so it's much more likely that the misfirings in my brain that are causing these spells will get worse. So I'm thinking of a church that we visited 8 months or so ago, 7 or 8 months ago, where we were sitting in church and my wife had gotten up to go change the baby's diaper, and we have 6 other children that were with us. So my oldest daughter, who's 17, who is one of my primary helpers, was holding, the 3-year-old while my wife was gone with the baby and things like that. And there were other children there, and I began to shake and twitch and all these kind of things that happened to me. And pretty soon there's a hand on your shoulder, and they say, we're here with medical services, and we want to see. Or sorry, people saying, do you need us to call medical services? Church security, or just a deacon, or just someone sitting behind you that sees that you're having this problem, that doesn't know you, doesn't understand what's going on, that it's just a normal part of our day, and we're used to it. And me being in a wheelchair isn't that strange after church. That we've become accustomed to things that probably people shouldn't become accustomed to. But that kind of idea that if people aren't aware, if there is not awareness about dystonia and what it is, and specifically how the symptoms manifest in a specific person, it can be really scary. So we do try to let people know, Mark has a medical condition, this is what it's called. Generally, we'll deal with it ourselves. If we need help, we will reach out. But people are concerned. People care about you, even if you're a stranger, because you're in church, they're Christians. Or even people on the street in different situations we've been in ministry, or just out at a park as a family. People would be concerned enough and loving their neighbor and want to help and see what they can do. But it's not helpful to call an ambulance when someone doesn't need emergency care. For us, there's companies with policies that will have those kind of things. But what I was thinking about today was part of that is, how do we raise awareness for a condition, I don't know if I want to call it a disease, but a condition that many people have never seen in their lives. And dystonia is one of those that I didn't know anything about it until my brother was diagnosed with it. And then after my brother was diagnosed with it, and we live in different states, like we're in Maine, he's in Florida, so we're quite a distance apart. And then I've met other people, but only 1 or 2 people in person that have dystonia. And it affects people differently. Some people have full-on seizures, some people have stiffness, some people have small muscle spasms in their face, and that's all they have. Some people, their speech is affected. Some people, their mind and their cognitive function is affected. I'm one of those that it's affected every part of my body, every part of my life. So how do we raise awareness? And one of the things that we do is we make these videos. When I'm having a really bad spell, we talk about it openly and publicly, and we encourage people that even though it may be embarrassing to show your weaknesses, at the same time, if we want to raise awareness so that there can be a cure, or if there can be research that gives us better medicines that can give people their lives back, or reduce their pain, or reduce muscle spasms, or whatever it is we can do, we want to encourage that. But there's also not just the research aspect. It's when you go to church, when you go to family gatherings, when you go to social events, when you're out in public. If people, a lot of people have seen someone with cerebral palsy that may have slurred speech or trouble walking, and I kind of look like that sometimes. Our son has cerebral palsy and epilepsy, so people are kind of used to seeing his left hand doesn't work, and he has seizures, and people have gotten used to that. But they've never seen an adult who can have a conversation and then falls into this that isn't a seizure, so they think a seizure. Well, it's not that, it's something else. Well, what is it? Is it a stroke? Because you look like you're having a stroke. So all of those social interactions are very difficult. And actually, to some extent, the person with dystonia tries to avoid new social situations because it's uncomfortable for others, and you don't like being a spectacle. You don't like being the show. So instead, we try to educate people. We try to inform people and make them more aware of what's going on. So one of the ways we do that is with videos. And if there's a new family coming over to visit our home, we let them know, you know, Mark has this condition. He may fall down. He may stop being responsive. He's not sick in the way like I need an ambulance kind of sick. There's really nothing you can do except maybe quiet down, or maybe we'll, you know, put a certain stimulus away that maybe, you know, a flashing light or something like that. Maybe Mark just needs to put on his headphones and go lay in his room and calm down for a while and just let his brain relax. Because I think the best explanation somebody gave the other day was it's like a frayed wire that's just waiting for something. You know, all it needs is one wrong connection and it's just going to spark off and freak out and do all that kind of stuff. So it's kind of like that, is a shorted wire in your brain that causes different muscles, different pains, different, you know, changes your heart rate, your blood pressure, changes all these physiological effects that happen because it's too loud, or because a light was turned on too quickly, or because something startled them. And not everybody has the same triggers or the same symptoms. So this is a broad-ranging type of condition that envelops hundreds of symptoms, and that's part of why people don't understand it. So one of the things we do is we make these videos, and when families come over, before they come over, we tend to say, Mark has this condition, so if you see something weird, he's okay. The other thing is we don't leave me alone. We don't leave me without someone who can explain what's going on to medical personnel who are concerned. Whenever I go to doctor's appointments, even with the coronavirus thing where Sarah's not able to come with me because we have other children that need to be attended to, because they're often, you know, a couple hours away in Bangor or Portland, different cities where she can't be available. Our oldest daughter is able to go with me, and she can kind of interpret even if I can't talk. And she's seen me every day, and she knows the things that trigger me, and she can answer those questions. So having someone with you that can answer the questions for you, being preemptive and letting people know, hey, we're visiting this church or this family's coming over, you know, Mark might have one of his spells, and I want you to know that he's okay and he's safe and he's not sad. Even if there are tears coming down my face, I'm not sad, and I can hear what's going on. I know what's going on around me. I can't interact with it sometimes, or I can't make my body do what I want it to do. In my mind, I want to walk normal steps, but in fact I can't. Or I drag my foot, or I fall to the side, or I stumble, or I need to use my walker, or even if I need to be in the wheelchair. Those are things that we're used to, and it's not uncommon for us. Much like you know, someone who is had legs amputated, is not uncommon for them to learn to do things with their hands that generally you do with your feet, or even the other way around, the things Josiah has learned to do where he doesn't have use of his left hand. The things he can do one-handed, or he can use his arm or his neck or something to hold things. He uses other parts of his body as a second hand. So we've just learned to adapt to it, and we've learned to work together as a team, and our children are all very helpful. And my wife is super helpful and able to communicate those things with people. So that's part of why we do these videos, but I wanted to address a couple of those things. I think I did. Memory is also an issue. So don't call an ambulance unless you know that someone actually has a medical emergency. If someone says to you, you don't need to call an ambulance, this is not a medical emergency, and that person knows what they're talking about, it's their family member, please don't. Because emergency services are needed for people who are in a diabetic shock or who are in a car accident. And if they're constantly being called to someone who doesn't have a medical emergency, then that's a resource that isn't available for people that do have genuine emergencies. So that's another thing that we've dealt with is when you do actually have an emergency, somebody may not be available to you because we've gotten this culture where minor things are called for, even against someone's will. It's, you know, we just got to get checked out. There may be a reason for that. I think usually it's for insurance companies and legal purposes. But for me, for my family, for the things that happen with me in my life, please trust my family. They do know what they're talking about. They have lived, my children have lived with my condition most of their lives. Some of them, their whole lives, they've never seen daddy go to work or drive a car or be able to go for a walk by himself. That's normal for us. It's what we've gotten used to. And it's not normal. I mean, obviously, that's why I'm on disability. That's why I'm not able to drive and not able to work. Because I have periods, and this is another thing. I have periods where I am a normal appearing person. Maybe in this video I look like a normal, typical person, because it's early in the morning. I've had coffee, which kind of keeps me going. I slept well last night. It's a nice day. There's not a lot of stress going on in my life. So I'm feeling good enough that I can make a video like this. But many days, that's not the case. Many days I lay on that bed with my 31 decibel slow down industrial strength earmuffs just to have less input from the world. Sometimes you can drop something on the floor completely by accident, and maybe it's not even that loud, but the response of my body and my brain is to shut things down and throw me, to the point where I'll fall or can't hold myself up. Someone has to hold me up in the chair. Another thing, do not touch me. What we're looking at in my brain is an overload. Too many things going on and frayed wires. The system is overly taxed. And think of it like a bridge. If you were driving across a bridge and you saw a few of the cables were frayed and you saw it bouncing around a little bit and you realized there was a problem with it, would your next response be to go jump on that bridge and to drive more trucks on the bridge, or would you back off and leave it alone? That's how we need to think about, at least me, for those who we know and who interact with me. If you're out on the street with me doing ministry, if you're sitting at a lunch table by me and I start shaking or moving around, just don't touch me. Don't come up behind me and put a hand on me to pray on me. You can pray for me. Please pray for me. But please don't touch me. Because it's kind of like that overloaded bridge. Because when we get to the point where the overloaded bridge is starting to bounce a little bit, it might just crash if we put more weight on it. So to me, that stimulus of touching, when I'm already in that state where my brain is freaking out, touching me will actually cause more problems. So that needs to be avoided at all costs. Please don't touch me unless you've been asked to specifically. Or if I have, now even if I've fallen, you know what? I'm better off having me. I'm better off stumbling and lowering myself to the floor than to have someone touch me if I don't want them to. And sometimes, I mean, people are just trying to help. And that's the thing about education and awareness, is people are trying to help. People love you. People care about you. They want to do something to help. And they feel like whatever I could do would be an assistance. But in fact, you're overtaxing the bridge and it's going to collapse if you keep touching. So that was a couple of things I wanted to say. I'm sure I didn't cover it all today, but maybe I'll do another video later. Sarah and I are scheduled to do our weekly video tonight, where we're going to talk about some topics that are also bouncing around in my head. So hopefully this hasn't been too scatterbrained. But in all of this, I mentioned church, I mentioned our family. I just want to say that God didn't make a mistake when he made me. There's things wrong with my brain, and those are the result of sin in this world. The whole world is cursed by sin, by Adam and Eve when they disobeyed God in the Garden of Eden. Each one of us has something wrong with us. We might have high blood pressure. We might have low blood pressure. We might have problems with different hormones. We might have all these different things, physical afflictions that can affect us. But the question isn't, is there something broken in our bodies? There's something broken in all of us. But ultimately, it is God who made me. He made me this way, and he didn't make a mistake. He's teaching me perseverance. He's teaching me patience. He's teaching me to rely on him. He's teaching me to trust him with each day and each breath. And sometimes those breaths are very hard. And he's teaching me to love my family and to be more compassionate to others who are suffering in different ways. And he's teaching me to rely on him to provide for our needs, because it's easy as a man to be, oh, I'm on disability, I need to do this, I need to do this, I need to do this. It's me, it's my fault, and I need to provide for my family. And a man does need to provide for his family. But also to say, but God has provided for our family through means for us right now of disability, of gifts from people, sometimes random strangers, sometimes anonymous things, sometimes people just stop by to drop off some food. People just love you. And those people wouldn't have opportunity to make those connections with our family and to show love in that way, maybe, if I didn't have this kind of condition. So it also makes me think about other people that need to be shown the love of God, that as Christians, we are the good Samaritans. We are the ones that are looking for people who need God's love, that need God's affection, that need grace and mercy and compassion. And so that's what's driven us to some extent to do ministry at those nursing homes that I used to work at, to go out in places where we don't really want to be, where it's not comfortable for us. But there are people there who need to hear the truth about Jesus Christ and him saving sinners from their sin. They need to hear those things. And so maybe God has actually blessed me with dystonia and with physical afflictions so that I would be more cognizant of what he's doing around me, of giving us opportunities to minister to people that we never would have thought to minister to before. And maybe God has got something going on in your life today. Maybe it's a physical illness, maybe it's a mental illness, maybe it's a financial condition, or just the state of our world in coronavirus weirdness. But what has God put in your life today, not to complain about, not to find reasons to not obey or to get sympathy and feel bad for yourself, but what things has God put in your life that are difficult, that cause you to trust in him more, that cause you to pursue him more earnestly, that cause you to look around at the others in your life and want to love them as Christ loved you. And so I know I've been all over the place here. This is how my brain works. I go from point A to point D to point C to point B, and I'm sorry if this has been confusing, but the bulk of who we are as a family is to glorify God in everything we do, in our weaknesses, in our strengths, in our abilities and our inabilities, in hard circumstances and in good, fun times. None of these things are beyond the ability to look around and see the glory of God, whether you're enjoying the flowers or the birds and seeing what God has created, or walking in the midst of a really difficult trial. God is there with us. And if we're in Christ, if we are a new creation in Christ by grace through faith in what he has done, then we sorry, I got lost. If we are in Christ, then we have nothing to worry about. We have nothing to fear because God is with us, and he will lead us into what we need to be doing with our lives. And he'll guide us by his grace, and he will provide for our needs as we seek him first. And so again, I'm sorry for being kind of lost and confused. There's things going on out there, and I cannot think about more than one thing at a time. But if I can think about one thing and concentrate on that, do all to the glory of God.